Hello friends, today we'll discuss about what we routinely call as piles or we recommend as hemorrhoids. What are they? Piles are present in every human being, हर इंसान में वो present होता है. It is there to avoid or to delay or to prevent mucus or a stool passing through when we cough and strain. They are there, they are naturally present. But due to some factor, one of the commonest is cushion or staining or heavy lifting or pregnancy or continuous diarrhea, all these prolapse of this mucosa, and depending on that prolapse, they are called as a stages of piles. Like if they are inside, that's called as first degree or second degree piles. If they are coming out, they are called as third degree pile. If they are coming out and not going inside, they are called as fourth degree piles. So piles can occur to anyone, everyone. So there are myths. So we'll discuss about a few myths. I have sorted out 10 myths which are common in the public. One of the first myth is, what are the chances that that means every person is getting piles? According to literature, approximately 75% of the people suffer from this pile symptom once in a lifetime. So you consider yourself either being in a 75 or 25% at present. So anyone or a maximum everyone would be suffering from one of the symptoms of a pile. So don't worry if you have a mildest symptom of a piles. Do consult a pathologist or pathologist and get your doubt clarified. Second myth is piles affects only elderly people. It is true in one sense, but not completely fact. The fact is because in elderly, because of the loss of muscle tone or cushioning, there are increased chances of getting piles, but there are also chances of getting piles in younger generation. In fact, nowadays we are getting more and more younger generation who are suffering from these piles. One of the commonest factor is sitting long time, binge eating, getting constipated, having continuous diarrhea, IBS, other symptoms. So it is equal in both young also and adult also and elderly also. The third myth is pile needs surgery. The fact is many of the piles, most of the pile symptoms can be managed conservatively with the help of good diet, few advices about the diet and few medical line of treatment. All these things can halt the progression of the piles from first and second degree to getting into a later stage. So don't be bothered or worried that mujhe piles ho gaya, that means I need to go for surgery. No, there are still chances that you can be cured and the disease can be halted at whatever the stage it is. The fourth myth is spicy food and cold surfaces causes piles. But the fact is, there are no such papers or such researches relating the relationship between the spicy food and piles. Because the food goes in different metabolism, the spices goes in different metabolism and the piles different metabolism. So the pain while you getting by passing motion is not because of the spices but because of the fissure which we have along with the piles. So as such, piles will not give a pain after having the spicy food, but the fissure with the piles will give you pain after having the spicy food. So if you're getting a pain, don't consider that it is because of the spicy food you had yesterday. It might be fissure developing into a chronic fissure in the problem. So do consult doctor immediately. That is considering same myth, the cold surfaces can cause piles. No, in fact we advise people to apply cold so that the vessel gets shrinkage and the piles might get cured or might get halted. Fifth myth is exercise must be avoided if you have piles. No, in fact exercises can prevent piles, where there are various exercises like a Kegel's exercise where we are going to constrict the pelvic muscle, which is going to increase the pelvic muscle tone and in turn can decrease the chances of getting piles. There are few exercises like lifting a heavy weight without any support or without any proper technique, which can increase the risk of having hernia and other intra-abdominal pressure things. But as such, there is no direct relationship between the piles and lifting weight. So if you have a piles, don't avoid exercise, because exercise is going to release your symptom and not going to aggravate it. The sixth myth is chances of cancer go up when there are piles. The myth came from the fact that many of the patients consult a doctor when they have an ulcer or a growth in the rectum and they are bleeding. They think that it is not because of the growth or a cancer, they think it is because of the piles. So as such, piles will not lead to cancer, but cancer can mimic as a piles, and then patient get diverted, get delayed, and they come the later stage when we need to do something aggressively without trying in the early stage of disease. The seventh myth is sitting continuously for longer periods don't cause piles. The fact is no, it is going to cause you piles, because sitting on the pressure, sitting there for a long time is going to give a pressure on the blood vessels near your anal area. So if you are sitting, if your job is sitting for the long time, please move around after 1 hour, 2 hours, do some exercises, do some stretching exercises, do Kegel's maneuver to activate your pelvic muscle to avoid getting into the piles. The next myth is piles can never be treated, it is recurrent. The fact is, the piles is a lifestyle disorder. If you are correcting your lifestyle, the piles won't recur. But if you don't continue, or if you don't correct your lifestyle, who is going to help you? No one. So it is you and your diet which is going to decide the fact or the fate of your piles, whether it's going to recur or not. So it is not that all piles are going to recur, but if you have a bad diet habit, if you don't follow the lifestyle, it can. So the surgery per se, there are very less chances of getting recurrences, even if with the help of laser and stapler. But if you are not following the diet properly, the constipation, the aggravating factor is not relieved, it can. So be sure that अभी तो ऑपरेशन हुआ मतलब मुझे वापस होने वाला है, नहीं. You have to be motivated to avoid it. Ninth myth is eating high fiber and food can prevent with the risk from developing hemorrhoids. No, only high fiber diet is not going to help you from having hemorrhoids. There are various factors like pregnancy, constipation, like congenital some anomalies. All these can lead to piles. So don't consider that if you are eating a high fiber diet, I will not get piles. You still have a pile. So don't get misdiagnosed or misconception that अरे अभी तो मुझे कुछ होने वाला नहीं, I eat lot of fibers. No, it can have a piles. Exercising or doing a cycling can lead to a piles. Most of my cyclist friend has asked me the same question. Are we going to increase the chance of getting piles? In fact, the study has shown that a cycling can in fact reduce the chances of getting piles, because when they are cycling, their pelvic floor muscles are continuously in a contracted phase. They are activated. Their muscles are so strong. So in fact, they have less chance of getting piles. So my friends in the cycling who are doing the cyclings, be assured that it is not that you will get a piles. There are other factors which can lead to a piles even though you are cyclist, but only a cycling cannot lead to having a piles. So these are today's 10th myth about piles. We'll come up with next few myths which are there, which few of my friends regularly ask. We will try to sort it off as soon as possible. So please do like, share and comment, and don't forget to subscribe our channel.